이제 두 번째 스페셜 세션입니다. 앤서니 리, 리디아 AI 공동 설립자 겸 대표님 모시도록 하겠습니다. 퍼스트 팬데믹, 디지털 헬스 데이터의 가치를 찾다라는 주제로 강연해 주시겠습니다. 박수로 모시도록 할게요.
Hi, everyone. My name is Anthony. I'm the co-founder and CEO of Lydia AI. Unfortunately, I cannot speak Korean, although I very much would like to. But I think you will enjoy this presentation because not many people know about what I'm going to talk about. And it's all about the digital health data that is available right now and how to make use of it. So a little bit background about me. So Lydia AI is something I started about 7 years ago. I've been doing health AI for a long time because I started in school. You see on the left here, I am an inventor. I create machine learning pipelines. I was doing machine learning basically in 2016, 2015 with under Jeffrey Hinton's lab. So, and he's the sort of creator of deep learning. And so I've been really thinking about how to do health AI, how to give health AI to as many people as possible. Because when you think about it, health AI, and you work with a hospital, you have to spend many years to integrate that technology into a hospital. So how do you get health AI in every consumer's hand? That was my original mission. And the closest thing that I found was insurance, health insurance, because it's related to health AI. So I'll talk a little bit more about that later. But you see that my mission in the previous slide is to insure the next billion people. To use what we call our health score to insure people. This is a very common slide. By this point, I think it's already very outdated. It's a lot of data. Like we create a lot of data every day, and a lot of this data you see is electronic medical records. I know there's wearable health, and it's very important, but a lot of it is actually medical records. And if you go to like the US or you go to Hong Kong or Singapore, a lot of times it's hard to think about like, oh, okay, you go to a hospital, you go to a clinic, your data is like stored there. So what are you going to do with that kind of data? So I'll give you another example. One single hospital over a course of 10 years, they will experience 10,000 cancer cases. Of this 10,000 cases, you break it down into the different cancers, you will not have enough samples to train any machine learning algorithm just from one hospital, right? So you can go to a clinic, and if that data is not centralized, it will be very hard to create any meaningful AI. Now, fortunately and unfortunately, COVID-19 really made a lot of governments really think about, what do I do if my citizen is sick and needs help, needs telemedicine, needs to see a doctor? And so almost every single country that has universal healthcare data basically started to devote more resources into digitization. So they created apps. They finished pipelines for you to access your own data. And the more common ones are just like COVID apps to begin with. And I'll talk through a few different examples as well. So government use e-health post-COVID, and they focus on the biggest amount of data that they are sitting on right now, and that is the national claims health data. And it turns out you can do a lot of things with that. In fact, if you go into academic literature, there's over thousands of medical papers that use machine learning algorithms since 2014 that uses national claims data. You could predict many, many things, as we have found out ourselves. It's cool now that after so much work in digitization, governments are allowing citizens to own that data themselves because it's their data to begin with as well, right? So, this is what I mean by the data pipelines that governments have been creating. And so in Japan, it's called the Maina portal. This is actually really recent as well. It allows a consumer to access about 100 days of their own national claims data. In South Korea, it is an ongoing process. If I say My Health Way, I don't know how many people have heard of it before, but if you have heard it, maybe you could raise your hand. My Health Way in Korea. See, only a couple. I'm glad a couple, but that is, you see, that is awareness of such programs is key. We have so much data through all of these initiatives, but not enough citizens know about this is even happening. So in Singapore, you also have through Sing Health something similar. And when you keep breaking it down in Greater Asia, you see a lot of these examples. Taiwan is a very good example. And you break it down to Southeast Asia, you see even the more similar things. Countries like Vietnam are very well known to have quite good data, Philippines as well. So it's very interesting. Everybody, you see the apps, they all look like My Health Way. They all look like My Health Bank. They all sound the same. It's because the government is really following this very predictable model of how to get the citizen to see their own data. So what can you do with that data? So if a citizen owns his own data and he or she consents that data to a machine learning company, for example, or a company that provides such services, you are able to actually predict many things. So with national claims data, one of the coolest things is that you can even predict mental health conditions, major depression, schizophrenia. And you could do that with a model input of about like 1 year to 3 years. And when you have seen 10 million people above over 10 years, there are patterns that start to emerge. And that is how deep learning is more effective than traditional machine learning in picking up these patterns and improving our understanding of a person's risk of disease. It could be mental health, it could be chronic diseases at a particular point in time. And that is a very powerful information. If I knew 3 years in advance my own health, my mom's health, my dad's health, what am I gonna do? I can do a lot of things. I could do a lot of financial planning if I know how much it's going to cost, right? So this is an example of some of the predictions that we can do. And everybody likes to use the AWC. Basically, if you want to put a model in a hospital, it has to be above 0.7. So we've published in many academic journals in medicine, in high impact journals, how to use national claims data to make predictions. And we can make all those predictions state of the art using national claims data. And that's super, super cool. So in our Taiwan case study, I'll share a bit. So we have an app and we give it to consumers. And the consumers can log in their My Healthway equivalent, and then they basically try to understand their health better. We call it health score. We delete all of the raw data. We don't need to do that. After 7 years, we have so much data, so much understanding of how machine learning works. We delete the data and we keep the score. So the score is like a credit score, but for your health. So how does it work in Taiwan? So as I said before, COVID was a way for a lot of governments to adopt digital. And the Ministry of Health and Welfare in Taiwan, they developed an app. It's called My Health Bank. And they've been doing this for many years, as you see here, is 2012. And most of the time, nobody knew about it. And you go out in the street and you ask, like, do you know My Health Bank? No, they probably don't know. But then in 2019, they started thinking about how do I get more people to use it? So there was COVID, and there was a shortage of masks. And so you could order inside or reserve inside the app where to pick up your mask. After that, you can also place a government appointment for your vaccination. Then suddenly it went up to 20 million, and now almost 98% of the population has this app. And they can see their own health data, and they can still order and reserve their kind of vaccination if they want to. So it's a very, very interesting app in general. And so I've been doing this for 7 years, and what am I doing for 7 years? I've been working with governments like Taiwan, like Japan, like China, and I've been telling them about the fact that they are sitting on a lot of data and that you can make a lot of predictions. So I mentioned that we published with the National Taiwan Hospital, the biggest hospital, and it was actually predicting in-hospital cardiac arrest and out-of-hospital cardiac arrest after 30 days being discharged. So emergency room crowding is one of the biggest problems in almost every single country. If you had the ability to know who is high risk and who should not be discharged, or who is low risk, who should be discharged, then that's a very powerful thing. So for heart disease, we could predict with very high accuracy using national claims data, mortality and 30-day, 60-day, 90-day readmission. It's a very, very powerful method to do so. We've also worked with private hospitals and the government to use the same information, but to predict all of the major chronic diseases, diabetes, cardiovascular diseases, the highest killers in Taiwan. And lastly, we work directly with the government with that app that you saw, and we make it more, we put AI into that process, basically. So what we did was we worked with the government. Now the government has created an app. It's hard to use. I'm sorry. It's hard to use their own government app. So we did our own app, but we work with them, and then we make it very easy for consumers to understand their different health risk. It's, and we break it down into how much, in terms of low risk, high risk for different diseases. And then we also include data that you have already, like in Apple Health, like in Google, or in Samsung Health, like something like that. And we also care a lot about mental health. And it turns out, again, you can use activity, sleep, and national claims to create a very crazy model for our mental health. And it's very, very accurate. The more important thing is the health cost planning, because I'm running a business, right? I'm venture-backed. I have institutional investors. I need to, continue to be able to give health AI for free. So that's why we work with insurance companies. And insurance companies, they like this because this is a natural conversation towards how much money you're going to spend that insurance can cover. So that's one of the reasons why they want to work with us. So when we work with like an insurance company, it's not only just, they want to help consumers better understand financial planning, make sales easier. It's not only that. That's an important part indeed. But a lot of banks and insurance companies have what they call health ecosystem thesis. And those are touch points with customers, and they're trying to give customers health services. And then that means preventive intervention. And the last part is basically healthcare outcomes, basically. Obviously, if you do not file a claim and you are healthy, then they are happy to. So that's basically it. Yeah, thank you. There. So I don't know how much time do I have. Is it done?
It's time done. Okay.
Great. All right,
Thank you very much.
Yeah.
Nice.